afternoon. Welcome back, everyone. Dr. Neal Barnard is a leader in nutrition and research. As an adjunct associate professor of medicine at George Washington University and a researcher funded by the National Institutes of Health, he has led key research studies to improve the health of people with diabetes, obesity, lipid disorders, and other serious health problems. His research has been cited by the American Diabetes Association and the American Dietetic Association in official policy statements on healthy diets. Dr. Barnard completed medical school and residency at the George Washington University School of Medicine in Washington, D.C., and in 1985 founded the Physicians Committee for Responsible Medicine, a nationwide group of physicians and lay supporters that promotes preventive medicine and addresses controversies in modern medicine. If you haven't already been to the Silver Lounge to pick up your copy of Dr. Neal Barnard's cookbook for reversing diabetes, I highly recommend it, as well as the other book, The Program for Reversing Diabetes, is excellent. And he's a New York Times bestseller of over 20 books, and an editor-in-chief of the Nutrition Guide for Clinicians, another great resource. And now, as one of his over 200 Food for Life instructors, it is my great honor to introduce to you Dr. Neal Barnard.
Well, thank you for coming. Let's talk about diabetes. You know, there are a lot of misconceptions about this disease. You're a doctor, you're sitting in your office, the patient walks in and says, "Doc, I've done great. I've really been following such a healthy diet. I didn't eat any bread all week. I didn't eat any potatoes at all. I didn't eat any rice. I didn't eat any noodles." What the patient is thinking is what the patient may have been told by other doctors, which is diabetes means there's too much sugar in your blood, and if you eat carbohydrate, that digests to release sugar, and so don't eat any of that stuff, and maybe if you're lucky, your diabetes will go away, except the patient says, my diabetes isn't actually getting any better, but I'm still not eating any bread. Okay, there are many sources of carbohydrate. Bread is one, potatoes, sweet potatoes, rice. Let's take a lesson from Japan. In Japan, you have the healthiest, longest-lived people on the planet. And what is the dietary staple of Japan traditionally? Huge amounts of rice, enormous amounts of rice. And if you look at diabetes prevalence in Japan in adults over the age of 40, before 1980, diabetes was really rare. It was 1 to 5% of the population. Very uncommon. What happened in Japan right around 1980, culturally? Anybody know? That's right, McDonald's showed up. And suddenly a whole bunch of non-traditional foods started to flood into the Japanese market. And the fat content, can you see that? See that? The fat content to the Japanese diet started to rise. Not as bad as ours at all, but it started to go up. And carbohydrates started to fall. In other words, the Japanese population overall was eating less rice and less rice and less rice and more cheese and more chicken nuggets. So by 1990, diabetes was 11 to 12%. Now this shows us two things. First of all, rice does not cause diabetes. If it did, they would have had a lot of diabetes back then and much less now. Secondly, it shows us that diabetes is not primarily a genetic condition. Does that surprise you? You know, there are genes for diabetes. You can see it going from grandparents to parents to kids and so forth. However, genes didn't change between 1980 and 1990 in Japan. And oftentimes what goes from one generation to the next isn't genes, but instead it's recipes or taste for food or other things that we give our kids other than DNA, right? So let's talk about this. If we take a lesson from the United States, we don't have a rice-based diet, we have a meat-based diet. And especially in the post-World War II period, meat started going up and up and up and up and up and up to an all-time high in 2004 of 201.5 pounds of meat per person per year. By the way, what was the big increase? More beef? More pork? Chicken. Americans eat 1 million chickens per hour. That's right. Oh, it's health food, isn't it? I don't eat red meat, I eat mostly white meat, I'm only eating chicken. Americans eat 1 million chickens every hour, and we are in the worst shape we have ever been in, as are the chickens. And let me say a special word of condemnation for cheese. We talked about cheese earlier, but cheese has gone up and up and up. And actually, if you extend this graph to 2018, we're now up to 35 pounds of cheese per person per year. Huge amount, okay. So as we have brought in more meat, particularly more chicken, and more cheese, what has happened to the diabetes map? Here is Montana, North Dakota, Minnesota, where diabetes was fairly rare in 1994. And here is Mississippi and Louisiana, where diabetes was more common. But as cheese and meat came in bigger and bigger and bigger, here's 1995, and 96, and 97, and 98, and 99, and 2000. And as the diet changes, the map changes. Diabetes comes roaring right in. And now I'm going to change the colors because I want to zero in on specific counties, but the map is getting worse and worse. Okay, you get the idea? So who does better? We talked about these before, but let me just show you this again. We talked about Seventh-day Adventists. If you split them into groups according to the diet they normally follow, meat eaters are heaviest, vegans are the skinniest, halfway between them are the fish eaters. This is the people who eat meat in moderation, semi-vegetarians. These are the lacto-ovo-vegetarians, okay? But what really counts here is diabetes prevalence. Meat eaters have a lot, vegans have very, very little. So there's something about a vegan diet that's protected. So my research team did this study where we brought in people who were overweight but didn't have diabetes, and we wanted to see what a vegan diet would do for them. And the only rules were to avoid animal products and to keep oils very low, and we asked them not to change their exercise, and it was a 14-week study. And they ate from the power plate foods, the fruits and the grains and vegetables and legumes. And they ate pretty indulgent seeming foods. Some of us talked about this before. And at 14 weeks, the average person had lost 13 pounds. Not calorie counting, not exercising, not limiting portions, not limiting carbs. They just lost about 13 pounds, about roughly a pound a week. Okay, so they lost 2 inches off their waist. They maintained their weight loss for more than 2 years. And their insulin sensitivity went up. I don't know if any of you ever had a glucose tolerance test. This is where the doctor feeds you 75 grams of syrup and then sticks you in the arm every half hour and tracks your blood sugar as it goes up. It turned out that as they had gone vegan, their insulin sensitivity had improved based on the results of this test. So NIH funded our research team to put this diet to the test for people who had type 2 diabetes. And again, it was a vegan diet that was low in fat. And so when I say low in fat, I don't mean that we take away the natural fats that are traces in vegetables or traces in fruits. There are tiny little traces of fats there. But it meant not taking their bottle of oil and slathering it all over their pasta and sauteing everything into huge amounts of oil. We taught them non-oil cooking techniques, very simple. And for comparison, we used the American Diabetes Association diet that was within the guidelines back in 2003 when we started. And what we track is something called hemoglobin A1C. And if you have diabetes, you know what this is. If I track your blood glucose, it goes up and down minute by minute. But A1C stays fairly constant, and it reflects your blood sugar control over the preceding 3 months or something like that. And if you have diabetes, we're trying to keep your A1C below about 7. So our participants came in, and their average A1C was around 8. And the red line here is people with the ADA diet, the conventional diet. They were cutting calories to try to lose weight. They were limiting carbs, and their A1C dropped about 0.4. Not bad. That's pretty good. But the vegans are the blue line, and they had a drop of 1.2 absolute percentage points in their A1C, which is huge. That's just average. That's a terrific drop. If you had a drug that did that, that would be a fantastic diabetes drug. Okay, so then we tracked LD. Are you familiar with LDL cholesterol, low density lipoprotein? Okay, bad cholesterol. You're not eating any cholesterol. You're not eating animal fat, so your LDL drops very nicely. And then we looked at body weight, and both groups actually lost weight, and there's not a substantial difference between the two. Minus 2.6 kilograms in the ADA group, and minus 3.7 kilograms in the vegan group. What is remarkable is that the ADA group was trying to lose weight. They were counting calories, and the dietitian would give them a menu that added up to 500 calories a day, less than what they would normally eat, and they would go to bed hungry, trying to starve the weight off. The vegan group was eating spaghetti all day long, and they lost more weight than the people counting calories. So we don't use calorie counting at all anymore. We don't tell people to go hungry. What we do is say, let's eat healthier kinds of foods that tackle your appetite in a healthy way so that your weight can come down without you trying to power it off and feel hungry all the time. Okay? So this is Vance. Vance joined our study, and he told me about his father. His father was dead by age 30. And he said, I know what diabetes is. It means you go blind. It means you lose a leg. This is what diabetes is. And Vance was 31 when he was diagnosed with diabetes. He was in his late 30s when he came to see us. But he went on a vegan diet, and the first thing he said is, this is really easy. Instead of meat chili, I make bean chili. How hard is that? This is not rocket science. And over a course of about a year, he lost 60 pounds. He stopped his diabetes medications. His hemoglobin A1C was not below 7 when he started. It was 9.5, which is terrible. But it dropped to 5.3. And for any of you who have diabetes, what does that number mean to you? That is a normal A1C. That is the A1C of a person who doesn't have diabetes. And when we got these blood results, I have to say, I was staring at the lab report because this was a new thing. That you have somebody who had diabetes for several years, terrible family history, and he's on medicines, and he comes in, he changes his diet, he stops all his medications, and his blood tests return to absolute normal. And he could go to any laboratory, any clinic in the world, and they would not diagnose him as ever having had diabetes. When we started to find this with patients, it became very controversial. Because many clinicians would say, you can't tell anybody that their diabetes went away. Don't you say that. Once you're diabetic, you're always diabetic, was the word. Some of you remember that. Diabetes is a progressive disease. You'll never get over this. But here was a person who didn't meet the diagnostic criteria for diabetes anymore. And I have to tell you what saved us here was surgeons. There were surgeons who were starting to do bariatric surgery. And I am not recommending this. But when you do surgery on somebody and they lose 200 pounds, so quite often their diabetes would go away. So people got quite comfortable saying that diabetes is a two-way street. You can get it, and if you do things the right way, it'll go away. Now don't get me wrong. Diabetes is waiting around the corner. All he has to do is go back to barbecue and Velveeta and Spam, and the diabetes will come back. All right? We'll see how that is in a minute. Oh, by the way. When I was asking his permission to share his findings, he said, make sure you tell everybody that my erectile dysfunction went away too. That happened. And by the way, let me describe that, in case I'm waking you up. The male sexual anatomy is a hydraulic system that requires good blood flow in order to work properly, if you catch what I'm getting at. And things are going wrong with it all the time. It was obviously invented on a Monday because there's all kinds of problems that can occur. But if a man goes into the doctor and he's 50 years old and he says, Doc, there's something wrong with my nature. He's not talking about performance anxiety. There's something wrong with his blood flow. And if the doctor gives him a Viagra prescription and sends him out the door, that doctor is in big trouble. Because if this man doesn't have good blood flow to his private parts, and that's the reason he's got erectile dysfunction. What that means is he's got atherosclerotic disease, he's got artery disease, and he's got it in his private parts, but he's got it in his heart. And he's got it in the carotids going to his brain. And he's going to have a heart attack or have a stroke within the next several years, unless you act now and tell him about it and do something. Erectile dysfunction is a sign of artery disease. Okay? And so that means that we want to treat it the way we treat artery disease. Low-fat, vegan diet, exercise, you don't smoke, try to manage stress to the extent you can, and your diabetes gets better, but so does your erectile dysfunction, and so does your heart. Okay, you with me? All right, good. This is Nancy. Nancy had a similar situation. She went into the vegan group. She lost 40 pounds. She stopped all her medications. Her A1C improved, but it's still in the diabetic range. It's not quite normal. So not everybody gets normal. It gets rid of their diabetes. The longer you've had the disease and the more the beta cells of the pancreas have been damaged, the less likely you are to be able to get rid of it. Even so, a vegan diet is still a great thing to do. It helps people to minimize or eliminate the medication. It brings their A1C down, and it protects their blood vessels. Now, Nancy had an interesting experience. She came running into our center one day, and she said, "It's the most amazing thing. I was cooking spaghetti last night, and I had a jar of spaghetti sauce, and I just cracked the jar of spaghetti sauce open." She had rheumatoid arthritis. And if you have rheumatoid arthritis and you get that grinding pain in your joints and your thumbs hurt, you know that whoever makes those vacuum-packed jars, they are sadists. They're trying to make your life difficult, and you can't get them open. You got all these gadgets to try to open a jar. Well, she had just opened it on her own, and she looked at her hands. She said, "This is a diabetes study. Why is my arthritis gone?" And I have to tell you, I wrote a book back in 1998 called Foods That Fight Pain, because I had seen lots of people whose arthritis went away or improved, because there are certain food triggers where dietary proteins cause the body to react by making antibodies. And the antibodies attack the joints, the lining of your joint, and cause rheumatoid arthritis. And if you get that food out of your diet, the antibody attack stops, and your joints feel good. Now, there are many different dietary triggers, and some people may not have a trigger that we can identify, but the most common one is dairy. And if you happen to have rheumatoid arthritis, don't take this on faith. Just give it a try. Completely vegan diet, no animal products, no dairy at all. Do this for a few weeks and see if your joints don't feel better. Again, it won't make everybody's arthritis go away, but for a great many, it really will. So her arthritis improved dramatically and actually went away. Okay, so this is my most important slide. I want to walk you through the cause of type 2 diabetes. This is really, really, really important. This is a muscle cell, and the reason that I'm showing you a muscle cell is that muscles are powered by glucose. Here's glucose. The glucose needs to get into the muscle. Just like gasoline goes into your car, powers your car, glucose goes into the muscle cell, and it powers your muscle. However, it can't get into the cell without a hormone, and the hormone is called insulin. There it is. Insulin is made in the pancreas, which is right behind your belly button. The pancreas makes the insulin, which I think of as being kind of like a key. From the pancreas, the insulin goes in the blood, and it reaches the muscles, and it's like this key that goes down into that receptor, the red receptor there, and it turns it just like a key turning a lock. And once the insulin attaches and it turns the little lock, then this signals these channels to let the glucose come into the cell. And here it comes. There it is. Okay. So, if you got type 2 diabetes, you got insulin. Your pancreas is still making it. You have insulin receptors. The insulin attaches to the receptor. It's all totally normal. It's perfectly fine. The thing that's not fine is this signaling. That's what's not working. It's sort of like when I was a kid, there was a prank that people would play. Kids would play. They would, when you were not home, they would stick chewing gum in your front door lock, especially on Halloween. So you get home and you'd stick your key in the lock and you couldn't get in your house. Hopefully you didn't live in a neighborhood like that. But anyway, what am I going to do if there's gum in my lock? There's nothing wrong with your key, and you don't want to climb in and out the window for the rest of your life. You've got to clean out the lock. If you have type 2 diabetes, what you have is fat, not chewing gum, but fat, inside your cells. And that's what's gumming up the system. So you've got a perfectly good key. It should be able to signal these channels to open, but fat particles are building up inside the cell, interfering with it. Where did that fat come from? It came from chicken fat, beef fat, fish fat. This here is wild caught salmon fat. That's olive oil, extra virgin olive oil. There's some corn oil. The fat that you eat goes into your cells and it parks there. And we call it intramyocellular lipid. It's there interfering with insulin function. Now, in my earlier talk, I was describing how that can affect mitochondrial action and interfere with weight loss. But it also interferes with insulin signaling, and this is what starts type 2 diabetes. So, if I am suggesting that the buildup of fat inside the cell makes insulin signaling not work, then I need to get the fat out of there. How much animal fat is in a vegan diet? There isn't any. And if I keep the vegetable oils really, really low, that fat starts to dissipate. It starts to go away. And so suddenly, insulin can act again. It can work again. And the person's blood sugar then starts to drop because that sugar at the top of the slide here starts to go into the cell. The fat drains out, the sugar goes in. Their blood sugar starts to fall. The diabetes goes away. With me? It's really, really simple. So, in other words, the guy who goes into the doctor's office saying, I haven't eaten bread. Who cares about the bread? What you care about is, did you slather butter all over your bread? Are you dipping your bread into that dish of olive oil at the restaurant? It's the fat packing into the cell that's causing their problems. Now, by the way, doctors can be forgiven for not knowing about this, or could be, until about 10 years ago, when the New England Journal of Medicine started publishing findings from MR spectroscopy, magnetic resonance spectroscopy. You put the patient into an MR machine and the muscles light up. You could see the fat there in the muscles, it's also in the liver, and then you could change their diet so you can watch it start to diminish. You can diagnose a person, say 15, 16 years of age, they don't have diabetes yet, but their family has diabetes. And they're eating chicken wings and onion rings and fatty stuff. And the fat is building up inside their cell. And you can tell them you're going to have diabetes in 10 or 15 years. Because they will. But you can change that course too. You can change your diet. You can make the diabetes never happen. All right, are you with me? The problem is the fat in the cells. And our strategy is to get the fat out of the cell. And if you do that, you can save the patient's life. Okay, so very important. You do want to have vitamin B12. You know about this, right? For a vegan diet, you need vitamin B12. And be careful, if you have diabetes, if you're on medicines that can cause hypoglycemia, now is when they're going to do it. If you're on insulin injections, let's say you're taking 20 units a day, and you're continuing your normal dose, and suddenly you're on the most powerful diabetes diet ever devised, the combination of your medicines and the diet is going to mean your blood sugar is going to go down. And so don't stop your medicines. Don't adjust your medicines on your own. What you should do is let your caregiver know that you're going to do a vegan diet now. And say, in the event that I get a low blood sugar, who shall I call? And because they have to be available. People very often become hypoglycemic within the first week or two. All right? Hypoglycemia just means that your medicines are now too strong for you. They are driving your blood sugar too low, and the symptoms are shaking and sweating and anxiety and hunger. This is a sign of too low blood sugar. And when you experience this, do a finger stick. See what your blood sugar is, and if it's below 65 or 70 or something like that, you call your doctor, and you let your doctor know this is what's happening, and the doctor will say, congratulations, you're on 20 units of insulin, drop it down to 18, and I want you to call me tomorrow. And then you'll be hypoglycemic again. And you go down and down and down and down and down and down and down until you're off. Not everybody gets off, all of them, but a lot of people do. This will not happen with metformin, or very rarely. This is not going to happen if you're just diet controlled. If you're not on medicines, you're not going to get hypoglycemic. This is not caused by a bad diet. It's caused by a phenomenally good diet and taking medications that are no longer appropriate for you. But don't throw them in the trash. One other thing. Be careful about the hallelujah syndrome. The hallelujah syndrome is, hallelujah, I'm vegan. I don't need any medicine at all anymore. And you throw all your pills and all your injections away. Be careful. If you've got diabetes, you might not be doing well. It takes time for things to get back to normal, and they may never get back totally normal. So you work with your caregivers, stick with your medications, make sure that you've got a good collaborative relationship, come off your medications when the time is right, okay? So, check your blood glucose regularly if you're on those medications. Now, for any caregivers in the audience, I can hear you screaming at me, saying, oh, sure. How many of my diabetic patients are going to do that? Think they're going to go vegan? My patients would rather pop a pill. No, they wouldn't. They would much rather get rid of this darn disease. They don't want to pop a pill. They don't want to inject anything. They would like to get rid of it. And the reason that you and they are skeptical about diets is that previous diabetes diets are not very good. They don't eliminate the disease. They're not designed to. They're designed to cater to your insulin. You know how much insulin you're on, so they'll say, well, eat about this much bread throughout the day, eat about this much potatoes. They just keep trying to keep carbohydrates steady so that you don't get into trouble anywhere. That's not what we're doing here. We're trying to tackle the cause of the disease and get rid of it to the extent that we can. And we've studied the acceptability of this diet and found that because you're not telling your patient to count calories, you're not giving them portion sizes, you're not making them carb count, and there are great benefits. They're losing weight. Their numbers are getting better. Their doses are going down. Their energy is better. Their erectile dysfunction is going away. They'll say, this asparagus is starting to taste pretty good. So they'll do it. And we have published a number of studies, actually more than this, on acceptability of vegan diets in different clinical populations, finding that people with heart disease or young people or healthy people with just a few extra pounds to lose, a vegan diet is every bit as acceptable as any other therapeutic diet. And for doctors, nurses, dietitians, this is the diet they ought to be prescribing. Okay? All right. So let me shift gears a little bit. In the course of some of our diabetes trials, I started to notice that some patients would do really, really well, and there are others who would say, oh, I just really miss cheese, or I miss this, or I miss that. For them, food seemed to linger on a little bit more than for others. And I started to wonder if there's something different about these people. Maybe something's going on in their brain. Because we've known for a long time that alcohol and recreational drugs stimulate the release of dopamine in the brain. It's a pleasure chemical. Food might do the same thing. So let me walk you through this just a little bit. This is one, up at the top here, that's a brain cell. And down here at the bottom is another brain cell. And dopamine, the pleasure chemical, the reward chemical, that's these little black dots. And when you do something pleasurable, like take a drink, shoot heroin, sniff cocaine, any of these things that are very powerful dopamine inducers, the little black dots come down here and they swim across and they go to these receptors down here, and that creates a pleasurable sensation that makes a person want to do whatever it was again. And it's not just drugs that do it, but overeating can do it, especially junk food. So it turns out that some people are born with too few dopamine receptors. These receptors here, these things that are like docks where a boat would attach, they don't have very many of these. So they might do normal things that other people could do, but they don't get normal dopamine stimulation. For you interacting with other people, you're exercising, your brain is always making a little bit of dopamine, it's going to the receptors and you feel pretty good. But if you don't have a normal number of dopamine receptors, you can do all these things, but you don't feel good. You feel kind of crummy. You're just not getting the dopamine you need. So my hypothesis was, if a person is craving cheese or craving sugar, what they're really craving is dopamine, and they're trying to drive it in there. It turns out that there is a gene, and this gene causes you to be born with too few dopamine receptors. Okay? So this will not be on the test, but just to show you how this works. If you have this gene, we call you A1+. That means you've got the A1 gene. That means you don't have a normal number of dopamine receptors. If you don't, we call you A1-. And this was in our NIH trial. I genotyped all of my participants in the study, and we found that 49% of them had this gene, meaning They came in because they had diabetes. I stuck a needle in their arm. I sent it to the lab, and 49% of these people with diabetes did not have normal functioning dopamine. They were low in dopamine. And my suggestion, well, let me show you what happened. We then looked at how they did. The people, and this, for genetic studies, we separate people into racial categories, which personally I don't think is appropriate because I think it's sort of an artificial construct in medicine. But nonetheless, this is the way you have to report your findings. So whether we looked at blacks or whites, the drop in hemoglobin A1C was not very good if they had this gene. And it was much better if they didn't. We found that people who had this gene that had too little dopamine didn't do so hot on their diets. They had trouble losing weight, mostly because food just kept calling out to them too much. So here's what I'm saying. Somebody can be born with genes that cause them to have not normal dopamine activity, and they crave food. They crave alcohol. They might crave gambling or anything that causes dopamine to be released. And as time goes on, if they gain weight from seeking food, then they might develop diabetes because they're overeating to get more dopamine. You with me? Now you might say, I wonder if that's me. That sounds kind of like me. Maybe I can get tested. Don't worry. The food companies treat you all as if you have too little dopamine. They are figuring out exactly how to make chocolate and cheese irresistible no matter what genes you actually have. Okay? So we treat them all like drugs. But our hypothesis was that this A1 allele, just having too little dopamine, contributes to overeating and weight gain, and that brings on diabetes. Okay? And we've been confirming that with other studies, that a lot of people have this genetic driver for eating that leads them into diabetes. Okay? Just to get a little bit technical for the scientific minds in the crowd, this is a meta-analysis where 5 different studies that looked at plant-based diets and diabetes. If you're to the left of this middle line here, that means A1C got better. And as you can see in every single study, it got better. So I offer this simply as really clear-cut proof that in a wide variety of populations, a vegan diet is the treatment of choice for type 2 diabetes, okay? Let me skip that. In the first study that we did for people with type 2 diabetes, one of the participants had had diabetes for about 18 years. And he said, you know, the worst part of this disease, it's not loading up my needles and having to inject myself. And it's not even knowing that over the long run I might have some really bad heart complications or something. He said, what is killing me with this disease is neuropathy. Neuropathy means your nerves are not working right. And if you're lucky, that means your feet are numb. But if you're not so lucky, it means your feet are the opposite. The pain nerves are firing and firing and firing. And you have pain. It could be stabbing pain. It could be cold, where for some reason your feet just suddenly feel cold. Or you get pins and needles. And you're lying in bed, and if the sheet just even touches your toes, it just lights them on fire. And as this happens, it's painful. But it also is completely dispiriting, because it's a lesson to you that my life is never going to be the same. And I'm never going to be able to be functional again. And that's what he had. But in the course of the study, after about 6 months on a vegan diet, he came to me and he said, you know, my neuropathy, I haven't just lost weight, my A1C is better, but my neuropathy is gone. I said, wow, that's great. You know, you've done really good on your vegan diet, you've done so well, and your neuropathy is improving, that's really great. He said, that isn't what I said. My neuropathy is gone. And actually, I never heard of this before, where neuropathy would go away. And so I was a little bit skeptical, and I kept with him for many months afterwards, and his neuropathy never came back. So I decided I needed to do a study just in people with diabetes and neuropathy. So we brought in 34 people. They were between 18 and 65 years of age. They all had diabetes. They had diabetes for years, and their nerves were being attacked and damaged by this condition, meaning this is long-standing diabetes. And the way we decided to do this test was we had a control group that got vitamin B12, sort of like a placebo, and the experimental group got a vegan diet plus B12. And the reason we did that is B12 affects your nerves. We wanted to make sure that just wasn't an issue for anybody, so everybody in the whole study is taking B12. One group is getting no diet, the other group is getting a vegan diet. Okay, And there's a neat way that you test neuropathy. Your ability to sweat in your hands or in your feet is controlled by tiny little nerves that go to your skin. And they're among the first ones that are attacked by neuropathy, so your sweat function no longer works anymore. And so I have a device in my office where you just put your hands on this little metal plate, and I can measure if your sweat glands are working or they're not working. And then as time goes on, if your neuropathy is getting worse, you can register that simply by having them touch this plate. And they can take off their socks and put their feet on it. And all I'm doing is just measuring their ability to have their perspiration work normally, because that's a nerve function. And what we found is that after a short period of time on a vegan diet, the control group got worse, but the vegan group got a little bit better. And then we asked them, are you better? Just, do you feel better? And what we found is that in the vegan group, your average person was between a 4 and a 5, so they're somewhat better to moderately better. And the control group really not so hot. So what we found with this rather small study is that a lot of people will find that within a very short time, not only are their numbers better, but the nerve function starts to be repaired as well. Okay? So, when we talk with people about diabetes, what they'll say is, food makes such a difference. And the big problem is soda. Not just bread, but it's going to be soda. Well, let me put a question mark on that. And can we tackle this? If you look at a meta-analysis that came out in 2015, it seemed to suggest that soda is a problem. They looked at sugar-sweetened sodas, and they said that sugar-sweetened soda would increase diabetes risk by about 18%. And even if you adjust for overweight, it was about a 13% increased risk. So the more sodas you drink, the more likely you are to get diabetes. Except that they did the study again, and now they didn't look at sugary soda. They looked at the ones that were sugar-free, artificially sweetened. And they found the same thing, that artificially sweetened sodas cause diabetes too. And if you adjust for adiposity or overweight, same story, diabetes went up. Well, wait a minute, what's that about? If sugary sodas cause diabetes, but ones that don't have any sugar in them cause diabetes too, what's happening here? Well, last year, a bigger meta-analysis came out. And they looked not just at soda, but at sugar from anything. Maybe from soda, sugar sprinkled on your cereal, sugar in desserts, sugar in anything. And here's what they found. If you looked at total sugars altogether, total sugars reduced the risk of diabetes by about 9%, meaning those people who ate the most sugar had a little bit less diabetes compared to other people. Not a significant difference, but it wasn't making it worse. And if it was fructose, just a little bit worse. If it was sucrose or table sugar, it was actually 11% reduced, and that was statistically significant, meaning this is not chance. People who consume the most sugar have the least diabetes. Wait a minute. What's that about? It doesn't make any sense. People who have the most sugar in their diet have less diabetes than other people? Why is it that sodas are associated with diabetes, but sugar overall isn't? Well, the reason could be sodas are served with cheeseburgers. In other words, sodas are terrible. Look how bad they are. See that soda there? That's what caused my problem. See, sodas are terrible. Look at how terrible that soda is back there. That's terrible. If I could get rid of that, that'd be a perfectly good meal, right? The point I'm making is sodas are not health food. But they come with other foods that are packing fat into the cells, leading to the diabetes. Ergo, the soda looks like a problem. And maybe it's just kind of a bystander. Again, I'm not encouraging people to consume soda, but this naive idea that sugar means diabetes means I got too much sugar in my blood, so it must be that the sugar in the soda, that made my blood sugar go up. And the reason this is a terrible way to think is because you can stop drinking soda and your diabetes is never going to go away. And you can take sodas out of schools, which you should. Kids don't need this. It's complete junk food. But it will not prevent weight gain and it will not prevent diabetes because that's not the cause of it. The cause of it is fat building up inside your muscle and liver cells leading to insulin resistance. So again, I'm not defending sodas, But you can't just use this as a scapegoat and pretend we don't understand this disease process. Okay, make sense? All right. By the way, sweeteners, as I mentioned this earlier, sweeteners have been dropping since about 1999. That was when bottled water became much more popular. And if that is all that we are going to do, is continue to beat up on sugar and sweeteners, we're really missing really, really important issues. Now, having said all of this, if a person has too much fat in their muscle cells and liver cells, then sodas that they drink will raise their blood sugar. And if they eat rice or potatoes or bread or anything, their blood sugar is going to go up because they got so much fat in their cells they can't get the sugar into the cells. But the answer is a vegan diet, and for the first few days their blood sugar might be a little bit higher than normal because they're still insulin resistant. But as the fat starts coming out of their cells, their insulin resistance gets better and better and better. The diabetes starts going away and their blood sugar starts to fall. Okay? All right, I'm shifting gears just a little bit. In Japan, researchers did a troubling study. They did glucose tolerance testing to identify people who had diabetes. They may not have known they had diabetes, but they found those who had diabetes and compared them to those who didn't. And what they looked at was their risk of developing Alzheimer's disease. And people with diabetes have double the risk of Alzheimer's. Why would that be? Well, part of it could be that diabetes attacks the blood vessels. It attacks the blood vessels to your heart, but it also attacks the blood vessels to the brain. But the other part of it is, in the same way that diabetes means fat has built up in the cell, causing insulin resistance, if those of you who were in my brain talk earlier know that fat increases the risk of developing Alzheimer's, quite apart from what it does for diabetes. So these things are hand in hand. The beauty of this is you don't need one diet to prevent Alzheimer's and another diet to reduce your diabetes risk. The same diet goes for both, okay? So let me just walk you through how we introduce a diet for people who have diabetes, and I'm going to have some special words for caregivers who are prescribing this diet. Okay, there are 3 steps really. The first step is vegan, the second step is it's low fat, and the third step is low glycemic index. I'm just going to walk you through them real quickly. It's very, very easy. Vegan means you don't eat animal products. Fruits, grains, vegetables, legumes. And if the patient says, I'm not eating any red meat, I only eat chicken, that should be okay. You have to show them this table. The leanest beef is about 29% fat, the leanest chicken is about 23%. And if you want to get the fat out of your cells, you need to go down to these foods that are really low in fat. Don't just go here to here. And don't go to salmon. Chinook salmon is 50% fat. That increases the likelihood of developing diabetes. Fish eaters have much more diabetes compared to vegan. Okay? So these are the foods that help clear the fat out. All right, so a vegan diet, low in fat. And low in fat just means we're not adding fats and we're not eating high-fat foods. So oils or oily foods, nuts and seeds, and avocados. Olives are very small, so I'm not going to worry too much about them. But if every night is a guacamole fest in your household, I have to say it's a better quality of fat, but it will still get into your cells and cause insulin resistance. With me? Okay, very simple, very easy. Fatty dressings, fatty condiments. But luckily there are non-fat alternatives with all these. And this is not a zero-fat diet. There are traces of fats in green vegetables, even if you're not adding any in cooking. There are traces of fats in vegetables and beans and fruits and grains, and your body needs these healthy vegetable fat traces. That's good. These, what we're talking about here, are added fats, and then the nuts and the avocados, which are unfortunately too high in fat. All right, so targets. If you want to reverse diabetes, let me give you some targets. If you have a packaged food, like a frozen dinner, about 2 to 3 grams of fat per serving should be your limit. That's really low, but you'll see it. That will add up to about 20 to 30 fat grams per day. Now, if you go in the store, use that as you read the labels. But anything that doesn't have a label, like an apple, don't worry about it. Okay, apples and anything in the produce aisle, you don't really have to worry about their fat content because it's all really low. I'm just talking about the frozen pizza that you might buy. Those are useful targets for you. And you remember this? A gram of fat has 9 calories, right? A gram of fat has, carbohydrate has only 4. And the people who fail are the folks who can't get this out of their heads about carbohydrate. There are so many people who say, I don't dare eat carbohydrate, I'm too afraid. They're carbophobic, and they're not eating rice, and they're not eating beans, and they're going back to fatty foods, and they will never get rid of their diabetes, and they will always struggle with weight. Okay? It's really important to remember, this is your enemy. All right? Fat is the densest source of calories. Number 3, glycemic index. Glycemic index is real simple. It was invented in 1981 by Dr. David Jenkins at the University of Toronto. And if you take white bread, what does white bread do to your blood sugar? Let's say you eat a couple slices of white bread. What will happen to your blood sugar? It's going to go up, right? Okay, so here it is, goes up. And it turns out, if instead of white bread, I had rye bread, it's, for some reason, it's a little more gentle on your blood sugar compared with white bread. So this is high glycemic index, that's low glycemic index. So all we want to do is pick the low glycemic index foods. It's not low carb, there's plenty of healthy carbohydrate, but these are the best choices. So if you go online and you look up glycemic index, you are going to have a migraine because there are many tables, they don't agree with each other, it's all confusing, and you're going to give it up. So let me just show you all that matters. It's really super simple. The high glycemic index foods and their replacements are as follows. Sugar itself is high glycemic index. No surprise, it makes your blood sugar spike. But fruit, even though it's sweet, is gentler on your blood sugar. So if you want something sweet and tasty like a dessert, that's going to be better for you than that. Easy? Okay, so white and even whole wheat breads tend to make blood sugar go up a bit. Rye and pumpernickel are better. I'm not saying you can never have this, but what I'm saying is these are going to be gentler on your blood sugar. White potatoes, high glycemic index. Sweet potatoes, low glycemic index. Most cold cereals have a high glycemic index. They'll spike your blood sugar, especially if there's a toy inside. Oatmeal and bran cereals, much lower glycemic index. Very simple. That's easy, right? That's basically all you need to know. Okay, so very important. The glycemic index does not take the place of the other considerations like being vegan and being low fat. If you go online, you will discover that a buttery muffin has a pretty low glycemic index. And the reason is there's so much grease in there that it's tying up all the sugar molecules and it has trouble getting into your blood. That doesn't mean this is healthy. Asphalt has a really low glycemic index, but don't eat it. That's like terrible for you, okay? So the important thing is that the foods be vegan. That's number 1. Number 2, keep the oils really low, and then just to sort out what's left, use the glycemic index. The glycemic index is third, and by far the least important of these, okay? So, fruits, grains, vegetables, legumes, that's a healthy diet. I walked you through this a little bit in a previous lecture, but just let me walk you through it again really quickly. Protein is a complete non-issue for vegans. You're getting plenty of protein. Without any special combinations, nothing. It's, some people say, yeah, okay, but I've got to complement my proteins. I've got to mix beans and rice at the same meal. Don't worry about it. Just the natural combinations that people eat give you all the essential amino acids. So if you want to complement your proteins, just say something nice about them. That's all you have to do. You don't have to do anything special. Calcium comes from green leafy vegetables and beans. Greens and beans, loads of calcium, and vitamin B12 should be supplemented. Very easy, very easy. Use our 21-day kickstart. It's a great thing for individuals. It's also super for anybody in clinical practice. It's a really, really handy tool. You've heard me talk about this a bunch of times probably, and it comes with an app that is free. Just go to pcrm.org and you'll see information about the Kickstart. It's in multiple languages. And we've had about 600,000 people have been using it. It's lots of fun. Okay, let me walk through for caregivers. I want to share with you how we institute this in our clinic. I hear from doctors all the time who say, I'm so frustrated. The insurance company won't pay me for doing any diet teaching, and I really don't have time, and I only have 15 minutes for every patient, so there's no way I can do any of the stuff that you're advocating. That's a terrible system. You need to change how you work. If you are prescribing x-rays, you need an x-ray department. You need a radiology department. If you are going to have laboratories, you need a laboratory. Somebody to draw blood, you need to do that. If you're going to talk to patients about a diet-related condition, you need some people on your staff who know about that and have time to do it. Because otherwise you're wasting everybody's time. Here's how we do it. The doctors at Barnard Medical Center, they're doctors. They see the patient, and all they need to do is in 3 minutes' time, draw a circle on a piece of paper and say, this is a muscle cell. The reason I'm showing you a muscle cell is that's where glucose is going, but the cell is full of fat. We're going to drain the fat out of your muscle cell. Your diabetes is going to get better. That takes 3 minutes. And the patient says, Doc, can I keep that piece of paper? The answer is yes. Tear it off and hand it to them. Then you walk the patient down the hall to the registered dietitian and say the dietitian is an expert in how this diet works. And she or he will design a menu for you. And so the patient sits down, and over the next 45 minutes, they say, here's what I eat now. Okay, that's pretty good. That's vegan. This isn't. Let's figure it out. And then they have a whole menu of foods that they like. And then you say, would you like to come to a class? It's free. We have one tomorrow, Thursday at 6 o'clock, and we've got another one on Friday morning. Why don't you come? Bring your reluctant spouse. You can do the vegan diet together. And they'll say, fine, that's great. And then the patient comes, and suddenly they've got the validation from the doctor, the information from the dietitian, classes where all their questions will be answered, they'll learn some cooking skills, and their lives are changed. You've suddenly allowed them to get over their diabetes. If you don't have those elements, you're never going to, it's going to be challenging for you and for them to tackle what is in fact a disease related to food and culture. Okay? So it works really, really well. So the way the nutrition support groups work, you could do this in any office, and this is what we've done, is if your office closes at 5 o'clock, at 5:01, just turn the chairs into a circle and make the waiting room into a classroom. And you could do it. We'll give you a diabetes curriculum for free. And it's fun, and the patients love it, and so do our doctors. They really have a blast with it because suddenly they're working with the patients. Instead of trying to bend the patient's arm about why they shouldn't be afraid of needles. Instead, we're talking about food, okay? So you have a primary caregiver who recommends the program, you have a group introductory session, and then you have weekly classes. Very simple. Really easy. Anybody can do this. You could set up the room. If it's really small, just set up a circle. If you've got a little more space, I like to do it like this, where you can have almond milk to taste and different things on the table if they pass around, and they'll pass menus and stuff, and it's more collaborative. Have between 15 and 20 participants. If you have 3 or 4, they know you're looking at them. They feel like they're under a microscope. They're feeling guilty. If you have more than 20, they don't have time to talk, and you need to have a group work with each other. And then what you do, oh, by the way, anybody can attend. They can bring their family members, and we don't charge them anything. The classes are always for free. All right? And you say, how am I going to get reimbursed for that? Who cares? You're making enough money already. You need one staffer, if you have 1 hour, just work an extra hour and help your patients. Okay, it's a simple thing. That's why you're a doctor. Okay, all right. If they've got a kid that they had to pick up at daycare and they weren't sure what to do, just let them bring the kid, have them have some toys, give them a spot in the corner. It's all going to work out fine. Okay, and here they come in at, say, 6 o'clock. Weigh them. Everybody needs to be weighed privately, but they need to track how their weight is doing. Because if they're not losing weight, they're going to say, well, I'm not losing weight, but I think I'm losing inches, or at least I feel better. No, that's a failure. If you're not losing weight, it's not working. Cut them some slack for 1 week, but if they're not losing weight for 2 weeks in a row, have them write down everything they eat and have your dietitian sit down and say, here's all the cashew butter and stuff that you're eating that's preventing you from losing weight. You'll find the issue. Okay, so everybody weighs in. Then go around the room and you start over here and you say, I want to hear successes and challenges. And the success is, okay, I lost a couple of pounds this week. That's great. Or I found a new recipe. That's fantastic. Okay, what's your challenge? My challenge is we got a vacation in North Carolina next week. We're traveling, and I don't know what I'm going to eat. Don't answer it. Let the rest of the group jump in. Okay, let's see. Where are you going in North Carolina? Is there a certain restaurant? You let them problem solve, and they become sort of a therapy group that works together. Okay, then that will take you to the bottom of the hour. Then next, do some kind of presentation. Teach them how cholesterol is made or how foods affect blood pressure. It's half information. It's half sort of entertainment, so they really feel like they're enjoying the session. And then give them some homework, and at 1 hour, kick everybody out. They will want to stay there forever. Blow your whistle. Everybody out of the pool. Get out of here. Because you want your caregivers to go home so that they're not feeling like they've got to be everybody's friend for like hours. And you want the patients to realize this is short, this is sweet, this is simple. Go home and do it. And they will do it. And they come back the next week. And if they don't come, call them. And say, what happened? Is there some problem? Can I help you with something? All right? Give them your number. Give them some number they can call because they're going to get hypoglycemic in the second week. All right? So then the way you do the group is the first week everybody's scared and they're a little skeptical and they're not sure this is real and they figured that vegan meant they had to wear tie-dyed clothes. And so they're like people at the swimming pool in August. They're sticking their toe in the water thinking, I don't know, it might be cold. Do I really want to do this? And do I really want to be vegan? And so you're not confronting their skepticism. It's perfectly fine. You show them the cell. They think you're probably right, but they're not sure. So the first week, all you're going to do is just check out the possibilities. So what are the healthy foods that I could eat? They don't have to change their diet at all in the first week. They just go home and they think of breakfasts and lunches and dinners and things that they'll like. And then they come back, and the second week, now everybody goes vegan. And insist on this. You're going to be a good coach. They're not your employees, but they came to you for help. So you love your patients up, you work like a coach who really believes everybody can do it, and you're not going to take no for an answer. And so we're going to do vegan, right? We're going to do it? Yes, 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 we're going to do it. And so they go home and they do it. And they're always focusing on the short term. And if they goof up, just dust yourself off and come on back. But don't tolerate sort of doing it kind of okay. You sit down with the patient, let's really do this, let's tackle this together. And you'll find that it really works very, very well. Okay, what is healthful weight loss? If they have lost any weight at all, that's success for that week. It can be 0.0001 gram, that's okay, as long as it's going in the right direction. The average on a vegan diet is about 1/2 to 1 pound per week, but if they don't lose any weight the first week, it's all right. If they don't lose it for 2 weeks, then you really got to sort out their diet. It means something's not right. And if they're not losing weight, then the diabetes won't get better, okay? Okay, so they can write down their foods for a couple of days, go over it with a dietitian. You'll sort out the problem. All right, a few resources that we have for you. Our nutrition guide for clinicians. This is what we give away to medical students everywhere in North America. And in about 3 weeks, we have the 3rd edition of the nutrition guide coming out in print, but also downloadable. And it's for free. It's 90 health conditions and the role of nutrition. And it's going to be free, so anybody can download that. This is my new book on reversing diabetes, the new cookbook. Have a look at it. I'm really thrilled with how it turned out. And Drina Burton, who did the recipes, is just wonderful in the kitchen, so I want to tip my hat to her. We have Nutrition CME, continuing medical education, the same as the drug companies offer, only we offer it. It's all food, and it's all free. And we have hours and hours and hours of continuing medical education that will help you meet your course requirements. We have our annual conference. This one is in August of this year. Dean Ornish is our lead-off speaker, and we've got a great group. Dan Butner from the Blue Zones is going to be speaking, lots of others. It's going to be really, really cool. And the last thing I would just like to say is that when I was a kid, growing up in North Dakota, my extended family was all in the cattle business, and my father hated raising cattle, and so he left, and he went to medical school. And he set up shop as the diabetes expert in Fargo. And I never once heard him say, working at the Fargo clinic, seeing one person with diabetes after another, I never heard him say that anyone ever got better. I never heard him say, wow, it's amazing. I had 3 patients sitting where their numbers got so good, I took them off their medicines. Never happened. And that's because the diets they were using were diets that just kind of moderated carbohydrate and told people that if they had weight problems, they just needed to try to eat less. It was their fault. And this was before all the research that I'm describing now had ever been done. Nobody had MR spectroscopy scanners. We couldn't look into patients' muscles. We didn't know that they had a buildup of fat inside the muscles that was keeping the glucose out. And a lot of doctors today still have that 1950s mindset. They haven't bothered to read the modern research. And how they can get away with that, I'm not 100% sure. But today, we have power against this disease that we never have had before. And let me encourage you, if you have diabetes, put this to work, share your results with your doctor. Your doctor is going to say, that's amazing, how did you do that? Can I keep that diagram of the cell? You can bill your doctor if you like. Let's change the world. Thank you very much.